I'd like to introduce you to Dr. Flechas. He graduated with his medical degree from Loma Linda School of Medicine. He is currently a member of the American College of Nutrition and New York Academy of Sciences and medical director of a high-complex medical lab. Dr. Flechas is a lecturer and has numerous publications. Please give a welcome to Dr. Flechas. Thank you.
Thank you. Thank you for your welcome. Some of you have been asking, how do you say my first name? And the name is Jorge. I respond to George. It's the Spanish word for George. And then my last name is Flechas. And the word flecha, drop the S, means arrow. And when you add an S to it, it becomes many arrows. So frankly, I'm George Many Arrows. But we're going to have some fun here. We're going to be discussing boron. I became interested in this many years ago. At age 40, I was 5 foot 11 and a half inches tall. At age 45, I was 5 foot 11 inches. I lost a half an inch between ages 40 and 45 in height. So that I went to my mentor, Dr. Guy Abraham, and Dr. Abraham, I said, what is it that stops men from developing osteoporosis, osteopenia? He said, oh, you just need to take some boron. I said, what? He said, boron, trace mineral? He said, more than that, you know. So I started taking boron back then, and at age 60, I went back and I had my height taken at regular physical. I was still 5 foot 11 inches tall, and I went to Stanford Medical School. And there's a friend there who's a friend of mine. He's an endocrinologist on staff at Stanford. And I told him that I was taking boron to help stop my osteoporosis or osteopenia. He said, sure, you know, I got a DEXA bone scan machine here. Why don't you just crawl into that machine and let's do some measurements? So I said, sure. So I got into his machine. He came back an hour later and he says, whatever you're doing, just keep on doing it. I said, you're not getting away with that statement. I said, what did the machine show for my skeletal, you know, for my skeleton? He says, well, he says, you're 60 years old, but you've got the skeleton of a 20-year-old male. Okay? And I haven't lost any more height, and I'm still 5 foot 11 inches tall. So that really has helped me to get some impetus to see about what's going on in the field of boron research and so on. Boron is felt to be a metalloid element, which has many similar properties as silicone. Silicone is used by the body to help you retain fluid so that you stay better hydrated. It is best known for its role in bone health because of its effects on steroid hormones. And we'll talk about that towards the end. In the body, the highest concentration of boron is in the parathyroid gland. Now, just as you have lots of iodine inside the thyroid, inside the parathyroids you have lots of boron. And so it should give you a clue that boron is involved in calcium metabolism. It's involved in the heart. It's high concentration in the heart, the spleen, and in the bones. And again, you can see the connection between bone and parathyroid right here. And sure enough, that helps to explain why my skeleton was behaving the way it was. Now you'll notice that boron is with the metalloid chemicals, You got hydrogen, helium, and then number 5 is boron. And you notice that boron and silicone are right next to each other. Silicone not only helps you to retain fluid, it is a stimulant to the human brain. So you can stimulate. We've been able to take children off of their attention deficit disorder medications, their amphetamines, and just give them silicone. And silicone is a very powerful stimulant to the brain in all sectors. Boron also increases mental cognition in humans. It naturally occurs in the water, the soil, and in the food. In Canadians, we found that the intake of boron is 0.86 milligrams from the water, 2.5 milligrams from food, with a total of about 3.4 milligram per day. That's about the average for what it is in North America. Now, where I live up in Asheville, North Carolina, the intake of boron there is 0. There is no boron in the soil. Whereas we are right now here in Las Vegas, but not more than 100 miles from here or close to it is the Mojave Desert. It's one of the highest concentrations of boron on the earth, is just down the road from here. So the half-life of boron, when you take it, lasts around 21 hours in the body. Most of it is excreted by the kidneys. The accumulation is mostly in the bone, and a lethal dose of boron is 15 to 20 grams per day, 5 to 6 grams for children, and 2 to 3 grams per infant. Notice, look at the toxicity here as compared to what the average intake in the nation is. Kind of gives you an idea that we're way, way down from being toxic as far as boron is concerned. And we'll talk some more about that in a second. And there is epidemiological evidence that suggests that levels as high as 29 milligrams of boron per liter in the drinking water of the people in Turkey does not cause any overt symptoms of toxicity. If one were to drink 2 liters of water per day, that would be equal to 58 milligrams of boron per day. And basically what this is telling you is that the safety profile of boron is extremely high. So that even if you were to take 75 milligrams a day, you are nowhere close to where toxicity is, which would be in adults up to almost 20 grams or 20,000 milligrams. Oral intake of boron is readily and completely absorbed, greater than 90%, through the human gut as the boron combines with the fluids in your gut and the acid in the gut, and you get boric acid, which is almost 100% absorbed. What's interesting is that in the body, the boron blood to soft tissue ratio is about 1:1. But look at this, the ratio of boron in the blood versus bone is 1:4, showing us that there is a much higher concentration of boron inside the bones. In bone, a steady state is reached within a week. We saw this in rat studies where we gave them 3,000 to 9,000 parts per million of boron. They reached steady state within about a week. How essential is boron? Most of the medical literature that you'll look at will sit there and say that boron is not essential. It's just a cofactor, but it's not essential. Now, at the last conference that we had in Charleston, we discussed the sodium iodide symporter, showing us that this symporter helps to transport iodine from a low concentration in the bloodstream into a high concentration area, such as the thyroid. These transporters are used for transporting things in a small concentration into a higher concentration in tissue. Well, it turns out that the transporter for iodine was discovered back in about 1996. Since then, they've discovered about 80 or 90 different transporters, one of which is the transporter for boron. And what's interesting is that these transporters, this transporter is specific to boron, suggesting that boron is very essential for the body. The body has made allowance for the presence of boron to be there. In the absence of the transporter, the borate transporter, the transporter will conduct sodium and hydroxyl groups in the absence, that is, of borate. In the presence of boron, then you see a sodium-coupled borate co-transporter that's active. Basically, you will see the transporter moving in large amounts of boron into the tissues or into the bone. The presence of the transporter in humans is suggestive of it being very essential for human health. Boron appears to have regulatory roles in 26 enzymes, and mainly involved in energy metabolism. None of them require boron as a cofactor. Boron is essential for normal growth of plants, where its functions involve sugar transport, cell wall synthesis, and RNA metabolism. All of you have been influenced by this one statement right here. All of you have been involved in that because today, or within the last 24 hours, many of you sat there and took a product over here that was made from beets. Okay? That product that was made from beets provides a natural nitrate for you to be able to make nitric oxide. And it turns out that beets are very heavily dependent upon the presence of boron for their ability to transport sugar. So that the ability of beets to function and to grow like they do is dependent upon the presence of enough boron in the soil. So you've already been influenced by what's going on with boron just because of your going over there and taking one of those lozenges to help you make more nitric oxide. Boron and inflammation. There is evidence that dietary boron helps control the normal inflammatory process and may do so by serving as a signal suppressor that downregulates specific enzymatic activities, typically elevating during inflammation at the inflammation site. Suppression, but not elimination, of the enzyme activities by boron is hypothesized to reduce the incidence and the severity of inflammatory disease. What have I just said? Let me give it to you in practical terms. In Jamaica, there is 0 boron in the soil. In Jamaica, 70% of Jamaicans have arthritis. In the United States, intake of boron, 2 to 3 milligrams a day, 23% of our population has arthritis. Arthritis of aging, arthritis of rheumatoid arthritis, lupus arthritis, arthritis in all categories. Now we're going to go to Israel. In Palestine, there's lots of boron in the soil there, especially around the city of Jericho. But there's lots of boron in Palestine and also in Cyprus. And of the natural-born Israelis that were born and raised there in Israel, the incidence of arthritis is less than 0.5%. And what I'm saying is that arthritis in Israel is virtually non-existent. The only arthritis that you'll see in Israel is the arthritis of people who migrated there from other countries, where they did not where they have not been taking boron. How much do the Israelis eat? They eat between 10 and 30 milligrams of boron per day. Again, in the United States, if you take more than 2 or 3 milligrams of boron per day, you're considered to be getting toxic. And what you don't see is the fact that there are already people out there in the world, the Israelis, eating 10 to 30 milligrams a day. The people in Turkey eating between, and by the way, the other hot spot for boron production in the world is Western Turkey. So lots and lots of boron over there in Turkey, and the people there are drinking between 30 and 60 milligrams a day. And here you've got these, quote, scientists who are telling you that 2 or 3 milligrams is toxic. I'm sorry, there's something gone wrong with our science. And you've already seen it within your own field of work. And what you see here is that boron has the ability to reduce inflammation. Like if I came down with an infection, the body revs up, right? And so you've got this inflammation revving up, and it stays revved up unless something tells it to rev down, okay? And that's boron. Boron helps to reduce, the revved up immune system to keep it from giving you such a hard time. There's a review of papers that have been done showing that boron on aspects of physiology relating to the inflammatory process. Boron helps to reduce joint swelling, restrict movement, fevers, antibody production, hemostasis, serine protease, lipogenase activity, leukotriene metabolism. Basically, boron, all of these are involved in the process of making swelling and joint pain and so on and so on. Boron helps to decrease this revved up immune system or revved up body that's ready to give you a really hard time, and then it should rev down. And in fact, boron is what facilitates the ability of the body to be able to rev down. Boron has anti-inflammatory activity when it is combined with amino acids in the body to form amine cyanoboranes. Arthritic bone is associated with a 20-fold decrease in the bone content of the bone, the boron content in the bone. So it kind of shows you that there is a direct relationship. We've already seen from epidemiology that boron deficiency, you will see an increase in arthritis in a population. Now we're seeing the opposite, that in bones that become arthritic and painful joints, that you can have there is a definite decrease in the amount of boron inside those tissues. Now, I don't know how much you guys were taught in dental school or what you've been taught, but the alveolar bone of the jaw, where's the corresponding tissues that look like the mandible in the rest of the body? Huh? No? What? No? I can tell we've got a problem here with teaching. The alveolar bone of the jaw is like the alveolar bone inside the lower spine and the alveolar bone at the head of the femurs. Okay? When you see, in your practice, when you see somebody coming in with teeth that are getting loose and they're losing their teeth at age 20 or 30, and you got somebody with full dentures at age 35 because they couldn't hang on to their teeth, you are looking at somebody with advanced osteoporosis on the way. When you see the loss of bone up here, you're going to see the loss of bone in the lower back, the loss of bone in the hips. You can influence that long, for at least 20 years before the people start developing their symptoms, such as the loss of height and so on and so on. You have the ability to do something about it early on before it gets out of hand. And your signal to that is the fact that these teeth are getting loose, the alveolar bone of the mandible is pulling away from the tooth, and the teeth are falling out. Okay? Does that make sense? And you will see this within your practice. Now, what they did is that they took some rats and they fed them a diet where there was no boron. The 2B rats were boron deficient versus the 1B had adequate amount of boron, 3 milligrams per kilo per diet. And what they did is that after the rats were born, after they were killed at certain times and they had a surgical procedure done to look at this. And the final statement here is what they found was that the total bone volume and the total volume of the mandible holding those teeth, what they showed was that boron deficiency in the alveolar bone of the mandible results in an altered bone healing because of a marked reduction in osteogenesis. What is osteogenesis? The making of new bone. This, you will see this. You deal with bones all the time, the bones of the mandible, and so on and so on. You need to understand that if you don't have enough boron in the body, that those bones will not heal very appropriately. Okay? Does that make sense? You've seen it. You've done work on these bones, and then they come back and the bone isn't healing. Why? Lack of boron in the mandible. Boron supplementation markedly reduces the urinary excretion of calcium and magnesium. The depression seemed more marked when the dietary magnesium was low. Boron supplementation depressed the urinary excretion of phosphorus and by the low magnesium, but not by the adequate magnesium women. What we're saying is that the loss of calcium in the urine goes way down when you give boron plus magnesium as a supplement. Not just boron, but it's the combination of boron plus magnesium. And some of you have problems with kidney stones, right? And what's happening with kidney stones? You're excreting a lot of calcium into the urine from which you're making your kidney stones. Well, folks, here's one way that you can alter the balances in your favor. And that is that you can give somebody boron plus magnesium, and the amount of calcium loss in the urine goes down to negligible dosing. Not large amounts, but negligible. So that you can see that we do have a way to stop the loss of calcium and the building up of stones inside the kidney. Boron supplementation markedly elevates the serum concentration of 17-beta estradiol and testosterone. The elevation seems more marked when dietary magnesium was low. Low boron showed depressed plasma, ionized calcium, and calcitonin. Where is calcitonin made? It's a hormone that's made in the parathyroids. And remember, parathyroid is one of the glands where there is high levels of boron in the tissue. This is probably an interesting statement. Boron supplementation markedly elevated the serum concentration of estradiol and testosterone. And we're going to come back to that statement in just a few minutes. What they have done is that they've looked at the ability of boron to increase cognition. And what they found is that when you take boron, there's a significant increase in mental activity. So therefore, never, never, never take boron just before you go to sleep, or I will guarantee you won't sleep. If boron wakes up the brain, it does not put it to sleep. So when the low boron intake was compared to high boron, there was a significant increase in the proportion of low frequency activity inside the brain and a decrease in the proportional high frequency activity, an effect that is often observed in response to general malnutrition and heavy metal toxicity. Performance in various cognitive and psychomotor tasks occurred with the low boron. When they contrasted with high boron intake, low dietary boron resulted in significantly poorer performance on tasks emphasizing manual dexterity, eye-hand coordination, attention, perception, encoding and short-term memory, and long-term memory. How many of you have these type of symptoms? You know, I can almost guarantee you that if I did a blood level of boron on all of you, that the level there would probably be down to 0. But the thing is that collectively the data from these 3 studies indicate that boron may play a role in human brain function and cognitive performance, and provide additional evidence that boron is an essential element for the human. Now, in this study, what they did was that they gave boron to people with arthritis, and they were able to show that the boron helped to decrease the total amount of arthritis pain that people had. 100 years ago, actually 120 years ago, no, 130 years ago, there were 2 plants in the United States that were in competition for potential exploitation as plants for treatment of arthritis. One was the willow tree, the bark on the willow tree. And what element did we discover in that bark that was so that was so helpful for arthritis in humans? Aspirin. Okay. How many of you know the term curandero? What is a curandero? Right. Among the American Southwest Indians and even among the Mexicans, there are these witch doctors. They call them healers. I call them witch doctors, but they provided an essential information for us, and that was that they sat there and said, you know, there's a plant that if you take the plant, crush it up, boil it in water, and then drink the juice from that plant, that it'll help decrease your arthritis pain. That plant was known as the borage plant. Well, it took almost 30 years after the discovery of aspirin for them to discover that the essential element in borage was boron. These plants have selectively the ability to pull boron out of the soil. The people over here in the Mojave Desert discovered that if you took the boron that was in the soil there, and boron, by the way, is never by itself as an element. Boron is found in a salt form, otherwise known as 20-multein borax. And borax is what they're harvesting out of the Mojave Desert. And borax, the people in that valley used to take borax and put some in the water and stir it up and drink it to take care of their arthritis. So, so basically it just is showing us that we've known about boron for years. It's just that, we've had to get these studies done in order to understand more about the effects of boron on arthritis. Boron and cancer. It's interesting that in the United States we do what they call the INHANE studies, and they looked specifically at the intake of boron in the population and prostate cancer. And what they found is that after controlling for age, race, education, smoking, body mass, dietary calorie intake, and alcohol consumption, an increased dietary boron intake was associated with a decreased risk of development of prostate cancer with a dose-response pattern, and so on and so on. And basically, the more boron you have in your dietary, the less prostate cancer we see in the population. And this has been seen all over the United States. It's not just localized to certain areas. But it basically shows us that boron has more to it than just, arthritis or anything else. Consider the boron toxic levels go lower the younger a human is. So higher doses of boron, greater than 30 milligrams per day, not recommended in young women of childbearing age due to the potential of toxicity to a developing fetus. So I just wanted you to be aware that if you give boron, give it to people in their 40s, starting at about age 45, when women start losing the ability to have babies, because it's at that point that the more crucial elements of boron are necessary for those of us as we're continuing to age. Here's the exciting part. Boron helps to control hydroxylation, OH, addition to a molecule of steroids. So you go from vitamin D2 to vitamin D3 to vitamin D4. Every time, the 2 represents 2 hydroxyl groups on the vitamin D, 3 hydroxyl groups on the vitamin D, 4 hydroxyls. Now you will notice that as we hydroxylate the vitamin D molecule and we add more and more hydroxyl groups, what are we doing to the vitamin D molecule? We're making the molecule more and more and more powerful. Testosterone to DHT. Is testosterone a biologically active hormone? The answer is no. Testosterone does nothing in your body. What does have activity is dihydrotestosterone. And it's interesting that in order to convert from testosterone to DHT, you need to add a hydroxyl group to the testosterone molecule to make DHT. You've gone from an inert product to a biologically active product by just adding 1 hydroxyl group. Guess what mineral controls hydroxylation of testosterone to DHT? Boron. You guys are good. You learn. Now here's an interesting one. Notice that estrogen is formed as estrone, okay? And then we go from estrone to estradiol to estriol. And what's interesting is your bioidentical hormones, what do? They try to give you more and more of the E3 molecule. The addition of hydroxylation of hydroxyl groups to the estrone molecule will first off give you a very powerful estrogen for the body, estradiol, which will push women very easily towards development of breast cancer and other types of cancers. But notice how you can take that estrogen molecule and weaken it by adding another hydroxyl group to it, and you get E3. And E3 is a fully active estrogen molecule, but a little bit weaker than the E2, which is the one that's causing all the consternation out there. And by doing so, you create a molecule. You can give women the estriol, which gets rid of their hot flashes but doesn't increase their potential of breast cancer. The use of boron supplements to increase in vivo production of hydroxylated steroids is controlled by a patent here in the United States. The oral administration of boron compounds such as sodium borate and boric acid increases the amount of hydroxylated steroids in the human plasma. This will help to prevent or alleviate pathologies such as osteoporosis caused by suboptimal circulating hydroxylated steroids. So what good is boron to you? Boron helps to decrease arthritis. And when you see your patients in the office and they tell you, doc, have you got anything for my arthritic pain in my joints? You can go and say, how about taking some boron? How about the patient who develops problems with decreased kidney function because they're taking aspirin or aspirin-like products? They're having arthritis pain. What choices do you have? The only choices you got is narcotics. But now we can use boron to help decrease the joint pain without influencing kidney function. Does that make sense? In medicine, the only choices that we've been given is if they can't take the non-steroidal anti-inflammatory type drugs, then we give them narcotics or we give them steroids. Now I'm providing option number 3, boron, to help decrease arthritic pain inside the human body. So our boron helps to decrease osteoarthritis or development of arthritis as you and I are getting older. Boron helps to decrease osteoporosis. I'm a classic case of that, but they have now, this came straight out of the patent, that they are telling us that this will prevent and alleviate pathologies such as osteoporosis. And the articles are published there if you're interested in looking at articles on boron and osteoporosis. But in my case, as I've already mentioned, at age 45, I had already dropped a ½ inch in height. Today I'm age 62 and I'm still 5'11". I have not lost any more height. I would bet you that many of you need to have your height checked. And if you are losing height, you need to start taking boron to keep you from turning into a little person. One of my patients is the daughter of a rabbi from Israel, and she and her dad were watching the people in his congregation leaving, and the father looked at her and he said, "Do you see that guy over there walking around like this? He's 82 years old. And he can't straighten out because he's so full of osteoporosis, and his skeleton is going away." And then he said, "That's a Jewish guy that came in from the Ukraine or Romania." And then he pointed to another man, 82 years old, that was walking out of the congregation, and he was like this, 82 years old, walking around like that. And she said, "What about him?" And she said, "Oh, he's been raised here in Israel. He's always been like that." He said, but you can tell a Israeli who was raised here in Israel taking 30 milligrams of boron a day, he said, you can tell them from the people from Europe because the Israelis all stand up tall and there is no deterioration in their skeleton. So basically, I just want to encourage all of you that, boron is crucial, and it's crucial for your health. One of the vendors next door has got a boron pamphlet that gives you some of the references that I've spoken of here. very good for you to do that. They also have some samples. I do not have any financial vested interest with these folks, but I do want to let you know that, it is available. And if you say, well, I'll just go on home and get me some boron from my local health food store, what you're going to find is that in the health food stores, they're selling you 2 and 3 milligrams of boron a day. When you really need is about 30 to 75 milligrams of boron per day to keep away from the ravages of aging like you and I are suffering from. Thank you.
Thank you, Dr. Flechas.